Has your child fallen and bumped their head? Likely, they're very busy. Now, are you missing something? Are you aware of the red flags of past concussions that may be limiting your child's performance in life, particularly at school and maybe sports? Well, I'm excited today to give you some information, important concepts about small falls, big impact. First, a story about Bobby. He was in grade 1, very motivated, very hardworking, but really struggling in school. Struggled to learn, struggled to do some reading. He did some occupational therapy, made some gains, but then he plateaued. The therapist noticed that his eyes seemed to not track the words as well as they should. Could it be vision? Likely. In fact, and unfortunately, Bobby fell off his high chair at 1.5 years. Small fall, big impact. Now the brain grows to adult size about the age 2 or 3. You can see in this graph the vertical purple line at age 2, age on the bottom, up the side is percent growth, and it kind of levels off. So that's 86 billion neurons, and we keep most of them for our lives. But we learn new things every day. What's going on? Well, what's happening is the neuro-centres of the brain are connecting, branching out. And when that branches out, that's learning, that's neuro-plasticity. However, they're very fragile to kind of a head bump. So much more important in young kids because, as you can see, the neural development happens way beyond age of 2. Now, if you do bump your head, 90% of patients have a visual distortion pattern that limits their performance in life. Red flags of previous concussions often show up at school. Look at Bobby. He bumped his head 1.5 years, and then years later, struggles in school for learning. Brain function is vision function. The eye and brain develop from the same embryonic tissue in the mother's womb. When you perceive this world, 50% of the sensory information that goes to the brain to perceive the world is through the vision. 90% of the brain is processing that information to allow you to perceive the world as you do. Brain function is vision function. So a quick recap, concussions are important. They're most important for children because that branching and developing of learning is most fragile in those developing years. If you do bump your head, 90% of patients receive a visual distortion pattern limiting their performance. And concussions have early and long-term consequences. Just think of little Bobby, little ouchie at 1.5 years and then struggles in grade school. If you want to diagnose a concussion, the best way is through neurovision screening. Much better than brain scans. Brain scans do not pick up the bruised and damaged connections between the neuro-centres in the brain. And again, brain function is vision function. I have more information for you at the bottom and a link. We have another webinar. It's 20 minutes, expands on the small falls, big impact. I also have a document on red flags of past concussions. How visually fit do you want your child to be? How much do you want to protect your child? Well, the first step is have them see me. Book an eye exam, book a concussion neurovision screening today. Do it now and receive a 50-page ebook on small falls, big impact. This will help educate you through your journey trying to offer the best care for your children. I look forward to seeing you at the office. Have a great visually fit day.